Welcome to part 4 of our Brainstem series. Today it's all about the medulla oblongata, a step 1 powerhouse. This little chunk of the brainstem is a big deal, controlling life or death functions and hosting key cranial nerves. We will start with an overview, where it sits and what it does. Then we will dive into its internal organization, including tracts, nuclei, and all the works. Next, arterial supply. Knowing the blood flow sets up those stroke syndromes. And finally, clinical correlations, high-yield cases that will pop up in the vignettes. The medulla is a small space with massive impact, from breathing to heart rate to tongue movement. Step 1 loves testing this, so get ready to localize lesions and connect symptoms to anatomy. Let's kick off. Before we dive into the medulla, let's map out our goals. Your step 1 cheat sheet for this session. First, we will cover the overview of the medulla oblongata, its location, and the big picture role. Then we will unpack its internal organization, think about the cranial nerve nuclei and sensory motor tracts. Next up, arterial supply. Those vessels are key to understanding the infarcts. And finally, clinical correlations. Real-world cases tying anatomy to symptoms like strokes or nerve pulses. By the end, you will spot a medullary lesions in a vignette from a mile away. Think weak tongue or breathing issues. Steps 1, all about applying this stuff, not just memorizing. So we are building that framework now. Let's lock in these objectives and master the medulla together. Alright, let's meet the medulla oblongata, the brainstem's southern star, stretching from the pons lower border down to the first cervical spinal nerves, right at the foramen magnum. This is step 1 gold. It's home to 3 vital centers. The cardiac center sets your heart rate. Too slow, too fast, it's in charge. The medullary rhythmic center teams up with the pontine respiratory centers to keep breathing steady. Life depends on it. And the vasomotor center tweaks vascular tones. Blood pressure, it's the game. Plus, it's the origin of the last 4 cranial nerves. Number 9, glossopharyngeal for swallowing and taste. Number 10, vagus, the wanderer for heart and gut. Number 11, spinal accessory for neck and shoulders. And number 12, hypoglossal for tongue movements. Step 1 tip. Lower cranial nerves plus vital signs, medulla is your spot. Let's kick off with the medulla's internal wiring. Step 1 loves these tracts. The corticospinal tract is a motor highway which starts in the motor cortex and hits the lower motor neurons in the spinal cord, driving the limb and the trunk movement. If you damage it, it will weakness that will follow. Next, the sensory nucleus of the trigeminal nerve. It handles pain and temperature from A and C fibers on the ipsilateral face, projecting to the ventral posterior-medial nucleus or VPM of the thalamus, facial sensory path. Then, dorsal column nuclei, gracile and cuneate, carry pressure, vibration, fine touch, and proprioception from ipsilateral body via A and B fibers. These decussate in the medulla as the medial lemniscus, heading contralaterally to the VPL of the thalamus. Step 1 tip, know these crossings. Medullas where the sensory flip happens. More medullary goodies. Step 1's testing your tracts and nuclei. The spinothalamic tract carries pain, temperature, and crude touch from the contralateral body. Fibers cross early, hitting the VPL of the thalamus. Think contralateral loss if it's hit. The inferior olivary nucleus is a cerebellar MVP, feeding motor control input. Think coordination. Nucleus solitaris, that's your taste hub, handling gustatory info from cranial nerve number 9 and 10. Vignette with the taste loss will point towards here. Then nucleus ambiguous, the speech and swallowing boss, which is tied to cranial nerve number 9, 10, and 11. Dysarthria or dysphagia screams this. These nuclei and tracts pack the medulla with functions. Step 1 loves this. A patient which cannot swallow, tongue's weak, medulla is your spot. Know the players and their jobs and you will nail those answers. Alright, let's move on to the arterial or the blood supply of the medulla oblongata, and a step 1 must know. 3 big arteries feed it. The posterior inferior cerebellar artery or pica, the anterior spinal artery, and the vertebral artery. The medial core, think about the vital centers, get anterior spinal artery juice. Next door, the vertebral artery supplies the middle ground. Laterally, pica takes over, bathing the outer medulla. Why do you care? Strokes, like medial or lateral medullary syndromes, tie to these vessels. Step 1 loves vascular questions. Tongue deviates, which artery? Anterior spinal, or vertigo or ataxia? Pica. Blood flows the key to predicting deficits. Occlude one and the specific tracts or nuclei fry. Master this map and you will localize lesions like a pro. Alright, it's time for some clinical gold. Medial medullary syndrome or Dejerine syndrome is a rare step 1 stroke. It hits the medial medulla when the vertebral artery, anterior spinal artery, or their branches clogs up. What are the risk factors? It includes age, hypertension, hyperlipidemia, diabetes, smoking, cardiac arrhythmias, hypercoagulable states, which is a classic vascular culprit. This isn't just a trivia. Step 1 vignettes throws these at you. For example, a 60-year-old smoker comes with a tongue weakness. It's a medial medullus. It's rare, but high yield because it tests anatomy and risk. The medial zone is packed with corticospinal tracts, hypoglossal nucleus, medial lemniscus, so symptoms here are very dramatic. In the next slide, we will unpack those, but for now, link occlusion to medial structures, know the arteries and the risks, and you're halfway there. Alright, now let's move on to the medial medullary syndrome symptoms. It is a step 1's localization playground. Depending on the hit, you will see the contralateral hemiparesis, which is a weakness on one side from corticospinal tract damage before it crosses. Contralateral loss of vibration and position sense, which means that the medial lemniscus gets knocked out, sparing pain. Ipsilateral tongue weakness, it's caused by cranial nerve number 12's nucleus or fibers that are fried, so the tongue deviates to the lesion site on protrusion. Facial palsy can sneak in if fibers stray, dysarthria if speech flatters, and respiratory distress if vital centers hiccup. Think lower medulla. Sensory deficits vary and nystagmus might tag along if vestibular connections wobble. Step 1 tip, tongue to lesion, body opposite. That's your clue. Know these triads, weakness, sensory loss, tongue. It's a medial medulla signature. Alright, wrapping up the medial medullary syndrome. Treatment and prognosis. Step 1 bonus points. Time is critical. Symptoms hit fast, so prompt diagnosis and intervention like thrombolysis for strokes are the key. Prognosis, it's a race against the clock. Improvements can take weeks or months depending on the damage. If the upper third of the medullus is affected, say just corticospinal, most regain motor strength, less vital center impact. But if the lower 2/3 fry, cardiac, respiratory centers effects can stick, even become permanent. Step 1 might not ask treatment outright, but knowing upper versus lower helps with the vignettes. Patient recovers arm strength, but not the breathing. Lower medullus the toast. Anatomy drives outcomes. Lock this in for those clinical twists. Alright, now we are going to switch the gears to the lateral medullary syndrome, which is also called as a Wallenberg syndrome. It is a step 1 classic. This rare gem strikes the lateral medulla, usually from a stroke. Think about pica occlusion, vertebral artery disease, atherosclerosis, or hypertension pushing the clots. It's a neuroanatomy jackpot. Lateral structures like spinothalamic, vestibular, and cranial nerve nuclei get slammed. Causes set the stage. Pica's the biggie, feeding the lateral medulla. Block it and chaos erupts. Step 1 loves this. Patients dizzy, can't swallow. Which artery? Pica or hypertensive smoker? Vertigo? Lateral medullus your bet. Next slide we will dissect symptoms, but for now, tie pica to the lateral real estate. It's a vignette darling. Know the cause, localize the lesion, and you're golden. Alright, now let's tackle the treatment for lateral medullary syndrome. Wallenberg's a step 1 darling, and while the exam won't grill you on therapy, understanding it ties symptoms to outcomes. First, antiplatelets like aspirin or clopidogrel. They stop clots from growing. Key since pica or vertebral artery occlusions the culprit. Statins jump in to manage atherosclerosis. Think about hypertension, hyperlipidemia risk. If atrial fibrillation is in the play, hello emboli, warfarins, your go to anticoagulant. Blood thinners like TPA might break up acute infarcts if you're fast. For dysphagia, a classic Wallenberg sign, repetitive transcranial magnetic stimulation can boost swallowing recovery. Add functional skill training, balance therapy, and habituation exercises to tackle ataxia and vertigo. Step 1 tick. Stroke patient, vertigo, dysphagia. Think about the lateral medulla. Pica, treatment hints at the prognosis. Let's check that next. Alright, now wrapping up with prognosis for lateral medullary syndrome. Step 1 loves a good clinical arc. Most patients bounce back to satisfactory daily living. Think about eating, walking, basic tasks, since it's often a unilateral infarct. Recovery is generally solid with lateral medullary hits. Why? Vital centers like cardiac and respiratory are medial, so they are spared here. Contrast with the medial medullary syndrome. Lower medulla's damage can tank breathing, but lateral's more sensory cerebellar. What about the time frame? Improvement kicks in over weeks to months. Dysphagia might linger on, but vertigo and ataxia often ease up. Step 1. Toss a vignette. Patient is dizzy but recovers walking. Lateral medullas is a good outlook. Know the anatomy. Pica's occlusion, lateral tracts, spared vitals. It's a high-yield win. You're ready to localize and predict like a pro. That's our medulla finale. Hope it's sharpened your step 1 edge. Best wishes as you crush this exam. You're on the fire. If this boosted your prep, hit like and subscribe for more high-yield goodness. See you next time.